Hey everyone, welcome back to Yaskasa Spark. This is a new video of part 1 of Genitourinary system, which is dealing with the subject of adult health nursing 2, and we are now going to see about the new topic of nephrotic syndrome. Let's see in this video. Let's start with the basic things. What is the nephrotic syndrome? It is not the one the disease, but the clinical disease or disorders, which the main characteristics of proteinuria, edema, hyperlipidemia, and high serum cholesterol, which is a group of disease with a different causes, but similar clinical findings will be appeared. The same way the symptoms will be related. We can relate it to the patients also that the face will be of puffy or leg and it will be pus. And why do low protein in the blood causes edema? We will be coming this question to back again. This is the mnemonics. In this slide, we can know about the nephrotic syndrome, which is often excessive loss of protein through the urine, which mean that proteinuria. These are the pictures. Like in exam point of view, you will be more conscious and you may be easily understanding by remembering this picture itself. So that I have given this picture, so read it and keep in the mind what the main conditions you have to keep in mind the signs and symptoms, that is of proteinuria, edema, hyperlipidemia. We have to keep the signs and symptoms in the mind always. This is a causes where like the infections or neoplasm or the drugs or the allergens may be using that. For amyloidosis means a disease where the protein is deposited in the tissues in the organs. The main things of etiologies. These are the reasons for getting of nephrotic syndrome. Dipping into etiological, nephrotic syndrome can be seized from the proteins, which are already we have previously seen. What is of amyloids? That is an abnormal proteins where the ganging up your organs and the infections are big players too. Think staphnobacteria and hepatitis, HIV, or even malaria. Then there are the cancers like leukemia and tumors. Seeking like the drugs of heparin allergens, and remember AINDA, which is of amyloids, infection, neoplasm, drugs and allergens. In real life, always ask about the meds and travel histories, healing moments, and yearly catch-up means of better control. Knowledge is a power one. Predisposing factors, which means of allergies that can be tip into the scale, or renal vein thrombosis blocks the blood flow like a traffic jam in your kidney, which is of sickle cell anemia as the extra strains. They are not the causes but accelerators. Think of them and as a weak links marking someone's vulnerable. We can also say that the screening for these in your history taking, which can be prevent the complications too. Let's healing this together with the patients when you learn these conditions easier. The main aspects is of clinical manifestations, which is of from the mild ankle pute to the full body, plus anesthetics, which is of bloating belly, and labs know that low serum proteins and cholesterols, and the patients feel irritable and itchy, which may they say with the malaise. Don't miss hematuria, which is of blood in the urine, screams, check me out, like that. In best stories, we will be hearing all these things, and once the patient has mistaking the leg swelling as a just salty food, it's turned out to be an nephrotic condition. So we have to tease the families about the measures of daily weights to trap them edema, empathy, and check whether it is a valid. So regularly they have to check. Diagnostics are the straightforward things. Stay with the history and physical and feel that edema. And urine analysis is a gold for spotting out the proteinuria. Abdominal USB checks for swelling, and renal biopsy nails the type of kidney and damages and histological types. And the nursing role is of we have to prepare the patient for biopsy, and explain the answer is quite like a kidney spot stuff. Fun fact is of 24 hours urine collection should be an so that we can spot it out, and so learn it accordingly. Management spills into medical and dietary, which means of ACE inhibitors like caterpillar, protein kidneys, and diuretic flash edema, steroids, calm inflammators, and anticoagulants, and prevents clots, and immunosuppressants like many drugs. These are the drugs we have to know about it. And in dietary management also, high protein and low fat and sodium restrictions, and so low protein diet all should be kept in the mind always when we are preparing the diet for the patient. Nursing management. Hygiene is the first thing we have to know about it, and assessing edema and also all the complications like renal failure. When we are not seeing these conditions, which leads to the complications. Thank you all for this wonderful sections for listening my video. This is Yazhini K J YouTube channel. Like, share, and subscribe my channels, and stay tuned for next video. Until then, this is Yazhini signing off. Thank you.